Question number 2, the name of the Right Honourable Chris Hipkins.
Thank you, Mr Speaker. To the Prime Minister, does he stand by all of his government statements and actions?
Yes, I do. I do stand by yes, especially the action with...
What was that? Where'd that come from? Don't look. I'm sorry, it's not a playground, for goodness sake. Just keep your tittle-tattle to yourself. In the meantime, just everyone recognise that a question is asked in silence and doesn't require any commentary. Please ask the question again.
To the Prime Minister, does he stand by all of his government statements and actions?
Yes, and especially the action that we're taking to fix our healthcare system. The previous government's botched merger left Health New Zealand with broken government and poor financial controls. And just to give you a feel for it, if you're a patient, you interact with a team member. If a team member interacts with a team supervisor, who reports to a team leader, who reports to an assistant manager, then a manager, then a service manager. The service manager reports to the general manager reports to the group director of operations.
We'll just hear the rest in quiet. It's just ridiculous.
Carry
on, Prime Minister.
Well, as I was saying, the amazing thing with our health system that we inherited from the previous government is that a patient interacts with a team member. The team member reports to the team supervisor, who reports to the team leader. The team leader reports to the assistant manager. The assistant manager reports to the manager, who reports to the service manager, who then reports to the general manager. The general manager, you might be asking, who do they report to? Well, they report to the group director of operations. And of course, they report to the regional director, the national director, eventually the chief of staff, then the chief executive, and of course, they report to the chair and the board.
Mr Speaker, has Health New Zealand verified...
Hang on. It's just when someone is saying to ask a question, keep quiet.
Has Health New Zealand verified that the reporting relationships, as the Prime Minister has just set out, is exactly what happens?
Yes, and that's what was provided to me by Health New Zealand.
Very good. Supplementary question, Mr Speaker. Does he stand by his statement that his government has a laser-like focus on bringing down the cost of living? If so, did hiking car registration fees and expanding road user charges raise or lower the cost of living for New Zealand families?
Well, the great news is that we are a government that is introducing tax relief for the first time in 14 years. We are lifting the tax thresholds so that people don't get caught in higher tax brackets that they don't need to be in. That means they've got more money so they can navigate the cost of living.
Speaker.
A point of order, Right Honourable Chris.
I asked the Prime Minister whether raising registration fees and expanding road user charges was raising or lowering the cost of living. I didn't ask him about tax cuts.
Well, the Prime Minister, I'm sure, might want to add to his comment so far.
No, I'm fine, actually.
Okay.
No good with that, no.
Well, that's a reasonable position.
He couldn't find any notes in his folder there for that one, Mr Speaker.
No, hang on.
Oh, the ventriloquist's away today. That's right. Oh, there we go.
Comments like that don't help with order of the House and certainly don't help dispose the member asking the question or making the comment to the goodwill of the Speaker. Could you please carry on with your next supplementary?
Did that laser-like focus on bringing down the cost of living lead to charging children more for public transport, which some young families has resulted in some young families spending hundreds of dollars more per week just to send their children to school?
Yeah, and what I'd say is a large majority of New Zealanders don't use public transport, and some of them actually drive. And some of them really appreciate the removal of the Auckland Regional Fuel Tax, and some of them really appreciate the removal of the ute tax. But what they all certainly appreciate is tax relief for low and middle income workers, a group of people that the Labour Party used to care about but has lost its way. David Parker cares about them, but the Labour Party today doesn't.
That's right.
Today. Supplementary. Did that laser-like focus on bringing down the cost of living compel him to reintroduce prescription co-payments, driving people away from preventative care towards hospitals costing more in the long run?
There's no evidence of that, but what I would say is that it is important. It is important, isn't it? Because I saw a Labour Party press release, right? And they had their numbers wrong, which is not surprising because this is actually what has been the issue. They assume that people will get a prescription every single week, but there's actually a $100 cap on those fees per household. So that's wrong.
The Honourable David Seymour.
Thank you, Mr Speaker. Can the Prime Minister confirm that the government is committed to spending wisely and cutting waste in order that it can afford to tax hardworking Kiwis less and provide the essential services they rely on?
Absolutely, and that was what was a feature of this last budget, was that we were able to invest more in frontline services, remove wasteful spending, give people tax relief and lay out the conditions for growth going forward.
A supplementary question. Who was that laser focus concentrated on? Pensioners who can expect to get just $2.50 a week, minimum wage earners who can expect to get $12.50, or one Philip Morris who just got $216 million in tax cuts?
I'll just say to the member, are you against low and middle income working New Zealanders getting tax relief?